first description of cervical cancer was found 400 BCE by the Greek physician of name Pericles Hippocrates and was considered incurable at the time. During the mid-19th century, where an Italian doctor, Rigoni Stern, recognized the pathogenic mechanism and noticed that the incidence of cervical cancer was rare among nuns. The 20th century epidemiology work demonstrated that the causation of the cervical cancer is linked with sexual intercourse. In 1970s, Harald Surhausen detected the human papillomavirus or HPV in warts and cervical cancer, and he subsequently isolated and cloned different strains of HPV. HPV is a sexually transmitted infection that plays a role in causing most cervical cancer. Cervical cancer is a cancer of the cervix, the lower part of the uterus that opens into the birth canal. It is one of the most common types of cancer in women worldwide, but also one of the most preventable. The cervix has two major cell types, the flat squamous cells lining the outer part and the column-shaped granular cells covering the inside of the cervical canal. Both types can become cancerous, but squamous cell carcinomas are much more common. Virtually, all cervical cancers are caused by human papillomavirus or HPV. There are over 100 different types of HPV, some of which pose higher risk than others. About 70% of all cases are caused by just two types, HPV-16 and HPV-18. Two proteins produced by HPV, known as E6 and E7, interfere with cell functions that normally prevent excessive cell division. This causes the cells to grow in an uncontrolled manner. The next video will present the 10 warning signs and symptoms of cervical cancer that you should not ignore. Treatment options for cervical cancer may include surgery, radiation, chemotherapy, or a combination of these. Early-stage cervical cancer is typically treated with surgical removal of the uterus. This option is the most effective in preventing cancer from coming back and is usually preferred when patients do not need to maintain fertility. Radiation therapy can be given alone or in conjunction with surgery or chemotherapy. It involves using high-energy X-rays or other particles to kill cancer cells and to shrink the tumor. Chemotherapy involves the use of drugs to attack cancer cells by interfering with the cell's ability to divide and grow. It is usually used with radiation therapy to improve the effectiveness of radiation or used after surgery to destroy any remaining cancer cells.